When I teach medical students about gastroenterology, I bring the patients into the classroom. Patients are our best teachers, and students have to learn that caring for a patient is different than choosing the correct answer on an exam. The patients sit with me on a stage and look out into an auditorium of over 100 medical students in their clean white jackets. The patients start by talking about the medical condition and what it's like to be sick and vulnerable. They talk about their symptoms. We create a differential diagnosis, and then the most important aspect of the session occurs. I say this: these medical students are our future generation of physicians. What do you as a patient want them to know about being your doctor? And although not in the same words, the patients all say the same three things. They want their doctors to listen to them, to truly care about their outcome, and most important of all, to provide hope. You see, a healthy person has 1,000 wishes, but a sick person only has one: to be well. And hope is different than a wish. You make a wish, you blow out the candles, and the wish is gone. But when you hope, you become an active participant to make that hope a future reality. A wish is a fleeting thought. Hope is the fuel, the journey, the struggle, and the destination. And when you're sick, the medical profession must do more than just provide the best medical care. It must also provide hope. And not false hope, because false hope could be very dangerous. False hope breaks the bond of trust, which is the key ingredient between a doctor and a patient. Setting appropriate and realistic goals allows us to stay grounded while still remaining quite hopeful. Have you ever heard these words? "I'm sorry, there's nothing more we can do for you." I did. When my mother was no longer responding to her cancer treatment, I sat with my mother and my sister in the doctor's office in utter shock. I simply couldn't believe there was nothing more that could be done. My mother's medical condition suddenly felt very different. It felt hopeless. The next 9 months were awful. My mother required intravenous feeding, drainage from a tube in her abdomen, and traveled back and forth from the hospital, my home, my sister's home, and ultimately admitted to a hospice. I thought I'd totally given up on her. At least I thought I did, until I met the director of the hospice, Dr. Michael Brescia. Dr. Brescia greeted my mother with kindness when she entered the lobby of that hospice, held her hand, looked her in the eye, and said, "Sandy, we're going to restore you." Dr. Brescia couldn't cure my mother, but he and his team did restore her by providing her with pain relief, activities she enjoyed, music she loved, and most important of all, quality time to spend with the family. When we came to visit, we play our favorite games like Balderdash and Pictionary. We laughed, and we allowed her to be a mother and a grandmother, the two roles she most cherished. My mother died peacefully with a musician at her bedside playing the song "Those Were the Days." Hoping to be alive forever is not realistic, but hoping for peace and comfort at the end of life provides dignity and sanctity to the beauty of that life. Have you ever hoped for a miracle? Well, breakthroughs in modern medicine can feel quite miraculous. In 1997, I was a young physician just starting out my career as an academic gastroenterologist. I received a call from an infectious disease colleague who asked me to put a feeding tube in a patient of his with end-stage AIDS named Tom. He wanted to enroll Tom in a new clinical trial with a new class of drugs called protease inhibitors. This was at the height of the AIDS epidemic, when the disease was so cruelly taking the lives of so many, and researchers were working day and night trying to come up with effective treatments. This clinical trial was only for patients with the most advanced stages of the disease, but you had to be strong enough to get started. When I met Tom in my office, he was so malnourished, I was afraid he would not survive the procedure of putting the tube in the abdomen. But there really were no other options, and with Tom's consent, we placed the tube, and fortunately, he tolerated it. Tom went on the clinical trial while receiving nutritional support through that tube. And I did not hear about Tom again until 3 months later, when my infectious disease colleague called me up and asked me to remove the tube. Now, the first thought that went through my mind, I'm not the doctor who removes a tube when a patient dies. Oh no, my colleague said, Tom is alive and well. And Mark, you are not going to believe how good he looks. And boy, was that an understatement. Because when Tom came back to my office, in walked a different man. Tall, robust, handsome, energetic, unrecognizable from when I saw him before. Tom put on over 20 pounds and was smiling with a grin from ear to ear. I took out Tom's feeding tube, and the next time I heard from Tom was 15 years later for a routine screening colonoscopy to prevent colon cancer. And the second time after that, 10 years later, for his next screening colonoscopy. And right now, Tom is sitting with us here in this audience. You see, miracles can and do occur. The new drug, the clinical trial today, can be the cure or the revolutionary new treatment of tomorrow. I've seen many miracles in modern medicine occur, and I hope, actually, I know we will all see many more. My last patient story is about a woman who would not be denied hope. Rini, an 84-year-old woman, came to me for a second opinion about a growth on her pancreas. Rini was well, and this growth was found totally by accident when she had a CAT scan done of her kidneys. Her other doctor saw the findings and told her that at her age, she should not undergo further treatment. She should just go home and get her things in order. Well, Rini was active. She was engaged in her community and her family. She was politically active. She was not ready to give up hope on living the way her doctor had. Rini told me if there was a chance that she could live longer, she wanted to take it. I asked her, was there any life event that she wanted to live to see? Oh, yes, she said. I want to dance at my grandson's wedding. Great, I said. When is that? Rini laughed. Oh, he's not engaged. In fact, he just started dating a great girl. I said, okay, we have our work cut out for us. So we got started. But before that, I explained to Rini that pancreatic cancer was one of the most dangerous and aggressive cancers to treat. I also explained to her, as I do with all my patients, that pancreatic cancer, like other cancers, can sometimes not go the way we want. And if there's ever a time where we no longer can control the disease, we will focus on comfort rather than further treatment. I learned this lesson with my mother. There is a difference between prolonging life and prolonging death. So we got started. I did an endoscopic ultrasound and biopsied the mass and confirmed our suspicion, pancreatic cancer. Fortunately, it was confined and had not spread. She underwent surgery, chemotherapy, radiation therapy, and she did well. Actually, she did extraordinarily well. She re-engaged in her life and family. She became an advocate for others with this disease. And she came every year as one of my patients on this stage, talking to medical students about pancreatic cancer. And 6 years later, I received an invitation to Rini's grandson's wedding. And we danced. We danced. Rini lived 9 years after her diagnosis of pancreatic cancer and died at the age of 93 from something totally unrelated. Unfortunately, for people with more advanced stages of pancreatic cancer, they will not have the cure that Rini had. But I've seen many gain precious quality time from treatment. And with medicine expanding at such an extraordinary rate with all the discoveries, if you or a loved one have cancer, there's hope for a new discovery, new treatment, and yes, even a miracle. You see, hope is essential to medicine and to life. At first, when we're diagnosed with a medical condition, there's hope for a cure or an effective treatment. If that's not available, there's hope for a new drug, a new discovery, a new clinical trial. If that's not available, there's hope to live to see a life event, like the birth of a child or a wedding. And if that's not available, even at the end of life, there's hope for peace and comfort. Don't let anyone ever take away the healing power of hope by saying, there's nothing more we can do for you. There's always something we can do for you, and there's always hope. Thank you.